Good day, everyone. I will be covering professionalism in medicine, concern for welfare of patients. The two learning objectives that we will be covering, students will describe the importance of treating patients with respect and dignity and explain when it is necessary to seek supervision or assistance to maintain high standards of care. Students will create response plans for scenarios where their ability to provide effective care is compromised, including steps to seek help and ensure patient safety, and then evaluate its adequacy through simulated exercise. You want to make certain that you're treating patients, families, peers, colleagues, essentially anyone you come across with respect and dignity, both in their presence and in discussions with others. Certainly, this isn't something where you want to be talking behind someone's back. It's generally unprofessional, and you want to make certain that you maintain that respect throughout the course of all your interactions. Discern when supervision or advice is needed from faculty and or preceptors, and immediately seek these out before acting. Recognize when your ability to function is effectively compromised, and ask for relief or help. Do not engage in romantic, sexual, or other non-professional relationships with a patient, even upon the apparent request of the patient. The role of professionalism. Well, we've covered this previously, but again, it encompasses all ethical behaviors, integrity, communication, and accountability. Recall that professionalism is important because it builds patient trust and confidence in healthcare providers. It enhances patient satisfaction and compliance with treatment, and it strengthens interdisciplinary collaboration within healthcare teams. The core principles of treating patients with respect and dignity include respect in medicine. Acknowledging that patients do have autonomy, and as long as they are in the right state of mind, they are more than entitled to make their own choices, even if they differ from the choice that you would hope that they would make. Again, we cannot force our own desire upon the patient. We can only educate them and tell them what the best course of action may be. But if the patient chooses something else, again, you need to respect their choice. Informed decision-making is important, making sure that the patient is aware of everything that can go wrong with a certain procedure or medication. Honoring cultural and religious preferences, again, listening actively and empathetically, all of these are important for continuing respect in medicine. Dignity in patient interactions includes ensuring privacy during exams and conversations, using appropriate language and tone, and addressing patients and families with compassion and professionalism. Our first case, a Muslim patient expresses discomfort with being examined by a provider of the opposite gender. However, the hospital was short-staffed, and the only available provider is of the opposite sex. What do you do?
Let's explore how to navigate cultural preferences in a way that maintains respect, empathy, and professionalism, even under resource constraints. How should a provider navigate this situation while maintaining professionalism?
Well, first, they can acknowledge the concern without judgment. I understand that this is important for you. Explore alternatives. Ask the patient if they will be more comfortable with a chaperone or perhaps even a telehealth consult to supplement the interaction. If no alternative exists, explain the situation with empathy, emphasizing that care will be provided respectfully.
What strategies can be used to balance respect for cultural beliefs and the practical limitations of care availability?
I would say start off with choices when available. Male, female chaperones, delayed exams, even maybe seeing an alternative provider sometime later. Trauma-informed consent certainly is important, draping carefully, explaining each step, and generally seeking permission before physical contact. Documenting the patient's preference and your efforts to honor it in the medical record is also very important.
How can communication play a role in making the patient feel respected and safe?
As always, you want to make sure to use empathetic, open-ended language. What would help you feel more comfortable right now? Actively listen and validate their concerns, even if accommodations aren't fully possible. And finally, just reassure the patient that care will be delivered with dignity and discretion.
It is incumbent upon ourselves to recognize when we need to seek supervision or assistance. If there's any clinical uncertainty where you're not certain if you can perform a procedure, you haven't done it maybe a year or two, you've never done it before, you're not certain if this is the right dosage of medication to give to a child, maybe you're not really sure if if the X-ray actually shows what you think it shows. These are all times where it's better to be safe than sorry. Go and ask someone who is more proficient in whatever procedure or imaging or medication it is that you're concerned about, and ask them. Seek out the information yourself. Go to UpToDate or any other medical source. Never, play Russian roulette with a patient's life. You want to make certain that whatever you're doing, you're taking care of the patient. Emotional strain. Keep in mind that we're all human, and so perhaps we're going through a divorce. Maybe, we lost a loved one, bankruptcy. Maybe none of those things. Maybe you're just working long hours. You're putting in 50, 60, 70, hell, 80, 90 hours a week, and you're exhausted. Emotional strain can take a toll on you. Maybe you work in the ER, and it's really not the amount of hours you're working, but the complexity of the patients that you're seeing. Maybe you saw a mass casualty incident and you were hit with a lot of patients with severe trauma. That can take a toll on you emotionally and psychologically. And so you need to be aware there's emotional strain that's going on. Ethical dilemmas are certainly important. Certainly conflicts can arise between patient wishes and best medical practices. This is something that needs to be addressed. Patient safety concerns. Maybe they're feeling overburdened, or you're noticing that there are some errors that are taking place in the care of the patient. Again, these are signs that you need to definitely seek out supervision. Escalate concerns to someone who is trusted, maybe a trusted mentor, supervising physician, maybe a colleague as well, or in some cases, maybe an ethics committee. Utilize hospital support systems such as peer discussions or wellness programs. I will note sometimes many jobs will end up having something called an employee assistance program. Typically, it's like an EAP. I think that's what they call it. So you can end up seeking out maybe some type of counseling that's available through the EAP without having to go through your insurance. Of course, eventually, if you have to, you can always end up, actually using your insurance or paying out of pocket or whatnot. Maybe if you're, religious, perhaps you can go to a clergyman, right? Individuals, that can also do counseling as well. And so this is helpful. These are things that you can do to try and alleviate some of these concerns. Proactively communicate with, any of your limitations to maintain a safe patient care. Ethical dilemmas in seeking supervision. A physician assistant notices a senior resident making a dosing error but feels intimidated about speaking up. Again, what do you do?
Let's talk about why patient safety must always outweigh discomfort and how to build courage in moments that matter. Should the PA student report the error? If so, how should they approach it?
Yes. Even though the resident is senior, the student's duty is to protect the patient. Start with maybe some curiosity and respect. Hey, I might be mistaken, but I noticed the dosage. Could we double check it together? If ignored, escalate to a preceptor or supervisor using institutional protocols. And finally, always document what you observed if needed for reporting.
What are potential risks of failing to intervene?
Well, patient harm is the first. There might be an overdose, underdose, even death, legal consequences if a mistake leads to injury, even if it wasn't reported, personal guilt or professional regret for knowing but having stayed silent.
How can institutions support a culture of open communication without fear of retaliation?
Promote team-based safety huddles where everyone can voice their concerns, train leaders to invite questions and respond with gratitude, not defensiveness, and finally establish anonymous reporting systems and protect whistleblowers.
You want to develop your own personal professional response plan. Sometimes there's like professional plans that you may end up getting in terms of a job regarding certain things that you're missing. Maybe you're not documenting appropriately. Maybe you're taking too much time, when you're consulting with a patient. But you can actually end up doing a performance plan for yourself as well. Some questions that you can use are, well, how do you handle stress? How is it that you handle high pressure situations? And you can kind of think back on your own life, your own experiences, perhaps in school or maybe other jobs or the military, and think back as to how it was that you were able to overcome certain obstacles in certain high pressure situations. and determine whether or not those are examples that you can then use for your current clinical practice. What resources are available to you whenever you need that support? How can you contribute to the workplace culture that encourages asking for help? So, once you have all of these questions and you've thought about it, you can then maybe create your action plan by identifying 3 strategies for maintaining professionalism under stress. List 2 mentors or supervisors you can reach out to whenever you're in difficult situations, and set one personal goal for improving patient-centered professionalism, maybe once a year, something that you can work on throughout the year. You want to make certain to recognize and address unconscious bias in patient care. Understanding unconscious bias includes the implicit biases that affect decision-making and patient interactions. These biases are usually unintentional, but they can lead to disparities in care. Some examples are assuming a patient's pain level based on demographic factors, making assumptions about compliance based on socioeconomic status. Recall that no matter where someone is from, a certain country, a certain region in a country, or maybe their own, demographic or socioeconomic status, they may not fit the stereotype that is attributed to individuals that are in these groups by society at large. You want to make certain to treat each patient as an individual and learn what it is that they value, what it is that is important to them. And you may find out that they may be vastly different than what you expect based on what you hear or what you've learned, from society. Make sure that you have self-awareness and regularly reflect on your own clinical decisions. This is one way of constantly improving and provides for personal growth as you continue on in your clinical practice. You can also end up using standardized treatment protocols to minimize bias-driven errors. Some ethical challenges that can occur. Well, full disclosure is important. Patients must trust providers who are transparent and honest about the mistakes that occur. Now, again, the patient may end up not trusting you, right? There's nothing that we can do to force them to actually trust you if a mistake has occurred. But generally, by being honest and forthright through anything that has happened in clinic, including where you've made a mistake, as long as you're able to come out and address it appropriately, even if an error has occurred, it will always be best for the patient. And certainly if there are repercussions that come about, so be it. But at least you were able to catch the error, make the patient aware of the error, and then fix it. That's what counts. Ethical guidelines encourage honesty as well in reporting medical errors. Challenges in error disclosure include fear of legal consequences, reputational damage, loss of a license, perhaps even prison time as well, depending on the source of the error. Emotional distress is common among providers when acknowledging mistakes. Sometimes, our pride tends to be, the worst thing that we have. We hold on to that thinking that it's actually something that's a source of strength, when in reality, that's actually something that is hurting us. We always need to look out for our patients. Steps for ethical disclosure. Acknowledge the error with honesty. Explain what happened and how it will be corrected. Offer support and next steps for patient safety. And reflect on ways to prevent future errors. Next case study. A medical student incorrectly reports a patient's lab results to an attending physician, leading to an unnecessary procedure. They realize the mistake 1 hour later. What do you do?
Mistakes are part of learning. What defines us is how we handle them, especially when patient care is on the line. Should the medical student disclose the error? Why or why not?
Yes, immediate disclosure is essential to minimize harm and correct the care plan. A professional approach might sound something like, I just reviewed the labs again and I realized I gave incorrect values earlier. I want to correct that right away.
What are the potential risks of not reporting the mistake?
Unnecessary procedures or treatments that could potentially harm the patient, loss of trust, especially with the team once the error is discovered, missed opportunities to learn and improve clinical systems.
How should supervisors handle disclosure of mistakes made by trainees?
Well, with support and a learning mindset, at least that's the way I would think about it. Thank you for telling me, let's fix this, and let's talk about how it happened. You want to focus on correction first, coaching second, never punishment. You want to use this as a chance to model transparency and professionalism.
How can a positive institutional culture encourage error reporting?
Well, it'll normalize conversations about mistakes in team huddles or debriefs. It rewards honesty, not just the outcomes. Provides psychological safety. Trainees, can be made to feel safe to speak up without fear of reprimand.
The role of emotional intelligence in professionalism. Emotional intelligence is the ability to recognize, understand, and manage emotions in oneself and others. Core emotional intelligence skills for medical professionals include self-awareness, understanding what your own personal triggers and reactions are. Maybe there's just something that kind of gets under your skin that annoys you. Being able to recognize that is one way of being aware of what that trigger is and just consciously doing everything in your power to avoid that from actually affecting you. Self-regulation means controlling your impulse and staying composed under stress. If you work in the ER, all of a sudden you see several people coming in with gunshot wounds. You start to panic because now you're part of an ATLS team. You haven't actually, revived them. This can be somewhat, anxiety inducing, even under the best of circumstances. Being able to control your impulse and being able to stay calm will be your best friend during these situations. Empathy is also important. Recognize that patients may be under, certain turmoil that's happening in their lives or in their, current medical state. And so you have to end up addressing their emotional and psychological needs. Social skills are also going to be important as well. Being able to communicate effectively with colleagues and patients, written, and being able to speak effectively is going to be one of the best skills that you can have in practice. Some of the ways that it supports professionalism includes enhancing doctor-patient relationships, improving conflict resolution in medical terms, and reducing burnout and stress among healthcare providers. Our next case study. A patient becomes aggressive and refuses to follow medical advice. The physician, already stressed from a busy shift, feels irritated. What can be done to alleviate this situation?
Let's talk about what it means to stay grounded, even when patients are not, and how your responses shapes outcomes. How should the physician regulate their emotional response?
Pause and take a breath. Use grounding techniques, count to 5, deep breathing techniques, step back. Recognize the trigger without reacting to it. Remind yourself, this is about the situation, not about me. Staying calm is not a weakness. It's a skill that protects your patient and your professionalism.
What communication techniques can de-escalate the situation?
Use non-confrontational body language, open stances, a steady tone. Say things like, I hear that you're frustrated. Let's work together on what we can do right now. Reflect and validate their feelings. You have every right to be upset. Let's talk through this.
When is it appropriate to involve another healthcare provider or security?
Well, if the patient poses a threat to staff or themselves, if they refuse to de-escalate despite calm intervention, if they need a break in communication for safety or reassessment. Finally, as always, you want to make sure to document and communicate clearly to the team what occurred during the incident.
How does emotional intelligence play a role in professionalism?
Well, emotional intelligence is the ability to manage your own emotions and respond to others appropriately. It enhances teamwork, leadership, and patient trust. It prevents burnout and improves decision-making in high-stress moments.
Fostering professional behavior among peers is going to be important because it's one way of holding peers accountable in a constructive way. If you're able to come out and lead by example, you're able to demonstrate respectful communication and ethical decision making. This is something that will be picked up by your peers and your colleagues. And so we're all kind of learning from each other. And so if you can set the standard, then other individuals around you can end up following your lead as well. You can also encourage open dialogue about professionalism and ethics. Sometimes just being open about this, or perhaps even just talking about this, within your medical team, is one way where this can actually end up helping to address some concerns that some individuals may have that they just haven't addressed previously. Institutions can support professionalism by implementing structured feedback and mentorship programs. They can develop clear policies for professionalism violations, and they can provide mental health and wellness resources to combat stress and burnout. Some of the long-term benefits include improved patient outcomes due to higher quality care, stronger team cohesion, and better workplace morale. Enhanced trust and credibility in the healthcare system will usually be improved if these measures are continued throughout time. Some questions to consider. What values define professionalism in your own practice? How do I handle difficult conversations in patient care? What steps do I take when I see unethical behavior? Again, set 3 personal principles, identify your 2 mentors, and develop your one goal that you're going to end up setting to improve throughout your clinical life. The final takeaway that I would have is, respect and dignity are non-negotiable. Every patient deserves compassionate, ethical, and respectful care, no matter who they are. Seeking help is a strength. Don't think that, being able to power through is always going to be the best course of action. There may be times where you have to do that, maybe for short periods of time. Powering through for months at a time isn't the best way to do it. Coming from experience, it would have been better for me to actually, look for advice from supervising physicians before it got to that point. And so, if you're noticing that something is wrong, you feel kind of off, you're not really taking a patient's, I guess taking a view of the patient's health with empathy and with respect, not like you used to. You've noticed there's been a change. Perhaps that's actually a sign of burnout or emotional strain that you definitely need to be addressing. Being prepared is probably the best key that you can have. Having a response plan will ensure professionalism in moments of crisis. It's kind of like when you have like a fire plan at home, for like my own family, we have like a little, plan that we've kind of like rehearsed, no different than you would say like in a building or in a school that you used to have, where like someone sets a fire alarm off, then everyone, walks out, calm and single file, they're outside maybe 100 feet, away in a perimeter. And so this is one way of kind of establishing a plan in case a fire breaks out in school or your house or, maybe your place of employment. Well, having a plan for dealing with stressful situations can end up helping you when those situations actually arise in clinical practice. Continuous learning, reflection, and feedback will play a crucial role in professional growth.